Hello and welcome on this Nurses Day 2021. And really look forward to the conversation that we're going to have over the next 20 minutes here with Sylvain Trepanier. I think I've got that right, Trepanier, right, Syl? Who's the Chief Nursing Officer at Providence, and who is, has so many accolades. And I think you can see this in his thing. He's a PhD nurse, but he's a PhD nurse that really understands what nursing is all about. And this year is so significant for our clinicians. After the year of 2020 and now into 2021, I look at our clinicians, our nurses, our doctors, and our nurses, particularly this week, that have given their heart, soul, and in some cases, their lives to treat patients with COVID-19. And there's no better time, and I don't think there's a better way than to celebrate all of that hard work that's been done. And we always knew that nurses were important. And the one thing I learned in medical school pretty quickly, and when I was an intern and a resident, is to love your nurse that you're working with. And it's always been a great relationship. And Syl, I'll start with that with you, and welcome and thank you and congratulations on Nurses Day and week. And we should say that every day is Nurses Day.
You got that right. Thank you so much, Rod. It's really exciting to be spending this time with you today. And thanks for taking the time to recognize our 48,000 nurses practicing at Providence, a very important group of individuals, like as part of the healthcare team. And it's a privilege. It's a privilege to practice as a nurse. And I would also say likewise to what you just, how you opened the call. You opened the call by expressing your, my own word here, your gratitude for being able to practice side by side with nurses. And same thing with me. It's my gratitude to be able to practice with physicians side by side through the last 32 years.
Wow. And we've all loved, and I think those of us nurses, physicians, we love working together as a team and with our pharmacists and our therapists and food service people. And I think that's why, we'd call nursing, it's not a job, it's a calling. And I always say that once you're a nurse, you're always a nurse. So whether you're an administrator, whether you're a statistician, or you're doing other things, once you've taken that oath to be a nurse, you're a nurse for your life. And it is, that's why we call it a calling, right? Instead of it's not a job, is it, Syl?
No, it's not. It's not. You're absolutely right. It's a very important calling, very important profession. Rod, for the last 2 decades, nurses have been recognized by the public through the Gallup survey as the most trusted profession in the United States. Well, that's exciting. It says a lot. And with that comes a lot of responsibilities.
It is. And, they look to their nurses. And, I just want to dive into some of this with you. When you think about things like vaccine hesitancy or understanding COVID, people really trust talking to their nurses, their nurse friends, on what they should do and how they should do it. And I guess I'd start out with this, Syl. COVID-19 is going to probably change us forever. What has it done to the profession of nursing on this Nursing Day?
It has had a significant impact. It's been a professional, personal, cultural, societal impact. And of course, our nurses are very much impacted by that. What I worry the most is we probably don't know what we don't know yet, right? And it's like that, for all the professions, people who have been day in and day out with this, over a year now. When I think about, we entered this as, here's how I see it. We've entered this as sprinters. Yeah. And little did we know that this is the longest marathon ever. And right. I'm not much of a runner, Rod, but that doesn't sound like a recipe for success. And that's concerning to me. That's why that's why it's very important that we recognize that, we talk about it, and then we figure out ways that we can better support each other, because the healing is right now and for the years to come.
But as nurses and doctors, we talk a lot about post-traumatic stress. And I think that's one of the things that, we use the term burnout. I hear burnout a lot. I don't know if I like that term as much, but we do recognize the whole concept of post-traumatic stress, what it means, and how oftentimes it can have a lingering effect. It doesn't, while while the epinephrine is flowing and we're able to do it, I think, nurses in particular just rush into the fire and do it. But really the more critical period is that time that happens after.
Yeah, you're absolutely right. And for some, the after is right now, and for others, not so much, as we know it within our own organization. The census of COVID is very different depending on which state you are, and quite frankly, depending on which market you are, even in big states. So for that, though, we do have the opportunity, and that's one of the biggest advantage that we have in being in such a large system is we do get to learn from each other, and we very quickly, everyone started learning very quickly what was happening in Washington State, and then all of a sudden, it became everywhere. And at one point in time, as you will recall, over the winter, it was Southern California, right?
Yeah.
That was on fire, and we were able to support our Southern California nurses. So there's comfort, and I think there's comfort in the nurses knowing and feeling that as well. And I say nurses, but it's really all of our profession. I hear that a lot as I talk to our colleagues on how much they appreciate that we've been able to support one another from across state, and there's a lot of value there.
Well, it's such a daunting task for you, and I think of the number 48,000. How do you keep it all straight? How do you, how do you deal with some of the issues, Sil, of the whole nursing, like physicians, is regulated state by state? Any thoughts on that, and any thoughts on, we've talked a lot about telehealth in the future as we come out of COVID, but what does it mean for you? Any thoughts on nursing regulation and how if you could, use a magic wand and kind of change that, what kind of reforms would you like to see as it relates to regulation in nursing?
Well, if I had a magic wand, I would ask for a one nursing license across all of our various states. Many of the states across the nation have gone to that the compact model as we know it, and it's not everywhere, and it creates significant barriers, and we certainly have lived those barriers through this pandemic. It was not that easy, particularly at the very beginning, to allow people to cross state and practice. We had to lobby, right, a lot, and making sure that people would change their rules, and they have to a certain extent.
Yeah.
And I'm afraid it will go back to what it was. So I think that we really ought to we have to figure a way to make sure that happens. States that are offering it are the Earth has not stopped spinning off its axis. It's working well. Oh, would you know? And quality of care is there, and the public is being protected. So I'm hopeful that we can make some headways and get us in one license across the country.
I have so many questions to ask you, but one of the things that I think worries the whole country is there's not going to be enough nurses. So what are your thoughts on, how we deal with those issues? And I know you're doing a lot of work with an academy in terms of nurses, but maybe just to hear your thoughts on, what we all know to be the next coming, 5 to 10 years, where we're all worried that we won't have enough nurses to take care of us.
Yeah, and this is one of those that the expression "it takes a village" definitely take a whole different meaning here. It takes some very serious, deliberate, meaningful practice, academic uh, partnership, for instance, and we have to make sure that we prepare our nurses adequately for future practice, and we have some work to do there. We also have to make sure that when we transition into practice, and you reference our clinical academy, we have to make sure that we really wrap our arms around our new graduate nurses, which is something I'm so proud of at Providence that we do so well. And I would argue that no nurses across the country, across the world, should be transitioning into practice without a residency program.
Yeah.
So
Yeah.
that's something that needs to happen.
Yeah, I kind of feel, that we don't get many things right in medical education for doctors, but I do think if I thought about coming out of med school and being thrown right into it, that residency training really is probably the most formative part. And I just worry about, new nurses that come in, and those of us who've been at this for a while, we almost don't see it anymore. And that's the danger. But it is a jarring experience where you've got the responsibility of people's lives in your hand, whether you're calibrating an IV, you're getting a medication, you're assessing a patient. We have to remember what that's like when you're a first year.
Yep, we do, and many of us can can flashback to this and have some, and the moments that we likely remember may not be so
Yeah.
good or a moment, right? These oh my God, this life is in my hand here, and you're absolutely right. So transition into practice is very important, but transition into specialty is as equally important.
The other thing that we hear a lot about, and it's kind of a mantra out there, and this year, uh, as the chair of AHA, we're talking a lot about workforce, and we hear a lot when we talk about nursing of top of license. What does top of license mean for you, Sil?
So it means, oftentimes when we hear it out there in the public, primarily means for advanced practice nurses to be able to practice to the top of their license, education, and the likes. So that's primarily what that means. And as you know, not every state has the same rules around the ability for advanced practice nurses to practice. Now, we're very fortunate in Washington State, for instance, Oregon, where we have a significant imprint. That nurses do have independent practice in those states, but in California and Texas, they don't.
No.
But what we mean about top of license is the importance to lobby to make sure that eventually all advanced practice nurses across the entire country gets to practice to the top of their license, educations, and the likes. And what also needs to happen is that we don't inadvertently, because of old practices, for instance, that we don't further reduce the practice ourselves.
Yeah.
By not aligning our new, our rules, our bylaws, and the likes to really mirror what the state allows those nurses to do.
One of the other things I hear from frontline nurses, and I hear it from physicians as well, but is we're spending so much time doing things that are not related to taking care of our patients. The electronic health record, a lot of clerical and documentation and things that more and more, and I know looking at some of the time studies, the amount of time that we get to really be with our patients seems to be diminishing. Any clues or wisdoms for this problem, Sil?
Yeah, that's a complicated one, and one that that I really want to dive in.
Yeah.
And we've already begun having some conversations around that. I'll just give you one small example.
Yeah.
If you look at so you spoke of the electronic health record. Well, we've done some work along the years to optimize that. And what I think where we all believe we are in in a position for is it's beyond the optimization. It's how can it be leveraged very differently. So adding artificial intelligence in there is very important for us to be able to leverage it appropriately. And then also, as you know, we have ability to do transcribing and dictation-like type of entering information into the medical record. It's not perfect, but it certainly helps the life of certain, of our physician colleagues. Why is it that we don't have that for nurses?
Yeah, I totally agree. And then I always worry about some of the documentation seems to satisfy someone in some office somewhere. But as clinicians, does the record really work for a nurse or for a doctor?
Yep.
And that's what I see as the biggest problem. And, I'm an old brontosaurus, at least in the paper world and in the world where we actually telephoned each other. I could get a report from a nurse in the ICU and wow, in 5 or 10 minutes, we were both on the same wavelength. We knew what we needed to do. And it seems in a lot of ways that instead of technology helping us, it's kind of gotten in the way of how we used to work.
Yeah, we do hear that a lot. In fact, it's evidence when we have visitors coming to our ministries, the regulatories, and the likes, and sometimes we do stumble on telling the story, and
Yep.
they themselves, right? So they, as a third party and clinician, coming in and to the record, and it's hard for them to to see the whole picture together. So that's a symptom right there of what you just described.
So if you were trying to convince me, and if I was I was in high school or college to become a nurse, give me your sales pitch.
Prepare to be wowed, right? I would say that I would encourage, and I encourage, quite frankly, anyone who has any interest in pursuing their dream for multiple reasons. I mean, if I had to do it all over again, I would do it all over again. It's such a privilege to be able to help others in their most vulnerable time, and also at the same time, so much joy in that we're able to witness that intimacy that we have with our patients, our the compassion that you're able to share. And I was recently asked the same question by an aspiring nurse teenager, and I was sharing with him that one thing that I guess I failed to recognize early on, and today is very important, is for aspiring nurse to understand that you also have to you have to embrace change, and you have to be able to be adaptable. Today we use the word agility, the importance of developing that competency sooner rather than later, and to be able to see that, to embrace change from a perspective of that, change not only is it necessarily in our profession because the evidence changes and we need to change our practice, but that takes a certain level of adaptability to be able to do that. And recognizing that at the onset, you'll be even better off.
The other thing that I've seen in nursing is that there's just such a myriad of opportunity. It's almost mind-numbing of what that nursing degree can lead to. I look at yourself as an administrator. You can do international medicine. You can do home care. You can do advanced practice medicine. You can do specialty. You can do research. Nursing research has exploded, I think, during particularly COVID and everything else. So it's also being able to plot out what the opportunities are.
Absolutely. You can make a difference as a nurse in pretty much any industry, in pretty much any function, as you just so well described. And let's also add to the list another really important particular role, which is to be a nurse educator. And the reason why I want to highlight this one is to go back to almost making for a full circle on how we started. We talked about the fact that we will need a lot of nurses in the future. And one of the problem that we have in that equation is not enough prepared nurses to be able to help and train and educate nurses. So that's yet one more role that's very important.
And I think those are some of the issues that kind of call it out. We've got to recognize education just as important as other things, because sometimes, when I talk to, potential educators, they said, okay, Rod, let me get this right. You want me to do all of this and you want me to take a pay cut. And I think we got to recognize that, the equity and the importance, and we've seen this in education, whether it's our elementary school teachers or high school teachers. I think we have that same gap in nursing education, that we have to see this as a important part, critical to the future of where we're going to be as we're an aging country. How do we find those nurses to be there to kind of do what they need to do? The other question that comes up still is, how do I combine nursing with my life, with my family life? And, I think sometimes as clinicians, and, I'll speak for my generation, not yours, but we just did it, right? But nowadays people say, look, I want a profession that's compatible with my family, my children, my partner, all of the things that are there. How are we doing a better job with that?
Super important, and thanks for that question. That work-life integration is extremely important for any profession. And one of the beauty of nursing is not only can you do different things as you and I just described, but it also, those different positions, those different types of nursing also allows you to find something that will better suit your family life at any given time. It's not uncommon. Nursing is still primarily a female occupied position by a long shot, 10-13%. I forget what the last percentage is nationwide. So 90% of them are female, and so having the ability to be able to have the important flexibility, particularly if they want a family. So the ability to work, so many hours, per week, and then you have the ability to stay at home, for instance. Yeah. So inherently, it's very ingrained and embedded in our practice, and it really allows for that flexibility. Now, that being said, if one thing that COVID has taught us, many things, but one thing that it's taught us is the importance of not always taking work home with you. It's hard as it is to spend 10, 12, 13, 14 hours, depending on on anyone's day, but it's hard as it is. You don't want to bring it home and carry it with you. So we've learned different ways to make sure that people get to have respite when they go home. For example, we had some nurse managers who started very early on introducing a process by the end of the shift where they would either talk one-on-one with the nurses before they would go home, or do a team huddle and had everyone talk about what was hard today, what made them smile today, all of that in the spirit of letting go before they go. Yeah. So now that you lived this needs to stay here. Now go home, go to your family. And that's really important.
And it's been so stressful too, that, that barrier, I know in the beginning of the pandemic, everyone was concerned, am I going to bring COVID home on my clothes? Am I going to do all of this and all that stress? And that border between your family and your work really, was stressful. The other thing that came up during 2020, if we look at what the big issues are, is this reality around health equity. And I think, nurses are so important in this whole issue. And maybe, Sil, just to say, as we look towards a world, hopefully, that looks towards more equity in healthcare, what's the role of nursing in that whole arena?
Oh, they're at the heart of it. At the heart of it. When you think about the whole nursing process, and there's, nurses are, they're in the center of the care of any patients that needs care, whether you're in the nursing home, whether you're in an acute care setting, telehealth, and the likes. Uh, and I think it's very important that we keep that in mind. One advantage I think that nurses have that can leverage is when we're trained, we are at the onset trained to look at the entire individual in front of us. Like we call it whole person care, right? And we're trained at the onset for that. And sometimes, depending on where we go practice, we might tend to get into an environment that allows us to be a little bit more technical and tactical. And my recommendation to all nurses is to remember on how we were trained, to remember to always look at the entire individual. And when you think about whole person care, it really speaks to cultural care and spiritual care and the likes. And when you embrace care that way, and what matters, right? What matters to our patients, and when you start there, when you start with what matters to you, when I see you, it's a sure bet that I'd be able to create this as a sacred encounter, and then the outcomes will be what they really ought to be, which is eliminating, right?
Yeah.
Eliminating all inequities in care.
Because you and I were on a panel talking a little bit about age-friendly health systems, and I would say it needs to be age-friendly, it needs to be culturally friendly, and I think sometimes our education in kind of understanding the differences of different ethnicities, of different people, and how they approach health and healthcare. We sometimes have a model that I would say is very suburban. We kind of see it one way, but really understanding that the populations that we deal with are so diverse and they really require different sensitivities.
It does. And Rod, I think that so from an education is very important. And I believe that the ideal world in which, and we need to get there, in which we can actually practice cultural sensitive care is to surround ourselves with individuals, with nurses, physicians, and the entire healthcare team that also embraces and looks like and mirrors the population that we have within our community, and that's the best way to make sure that we can actually provide proper cultural care.
Absolutely, I think it's a great place to end. And again, in as loud a voice as I possibly can, to give heartfelt thanks to every nurse listening here. It's not enough to say that we love you and that you're great and we appreciate everything we do. But I'm going to say it anyway. And hopefully, what 2020 has shown us is that great nursing is truly one of the most important things we could possibly have. And as we get into 2021, we got to tell the public we got a big job. We got to get this public vaccinated. So we got some more work to do, but I know all the nurses out there listening to us are up to it. And Sil, thank you for taking on the leadership of such a diverse organization, and where I have to say, so blessed to have you as our Chief Nursing Officer.
Thank you so much, Rod. Thank you for taking the time today, and likewise, a special thank to all of our nurses. We love you out there.
Great. Thank you.